So you're finally here from the Drug Enforcement Administration to audit my buprenorphine practice. I've been waiting a whole year. May I call you Clarice?
Don't mess with me, Doctor. I am Agent Waterboard. Last week you refused to give us permission to audit you. I have a warrant this time and 4 other agents with me. We are here to harass and intimidate you.
Thanks for the warrant, Clarice. I have been trying to get DEA to show me one for months now.
We knew once you had possession of a warrant you would share it with other doctors and they would realize there was nothing to be afraid of. Then they might get the courage to refuse to sign Form 82 and make more work for us.
That's right, Clarice. I will post my warrant on the internet as soon as I can scan it. Why don't we get started?
Okay, Doctor. You claim to treat opiate addiction with buprenorphine, but we know you're just a drug-pushing criminal and we want to discourage you or find an excuse to send you to prison. We also want to punish you and make an example of you for refusing to sign Form 82.
But Clarice, if you had scheduled my audit like I asked, I would have signed your form.
We just don't operate that way and we wanted to catch you and whoever was in your waiting room red-handed.
Why do you need 5 agents to conduct a routine audit of one defenseless old psychiatrist?
We're afraid maybe you're like that Hannibal psychiatrist in Silence of the Lambs and we didn't bring our guns. Honest. We also need to watch all those patients in your waiting room. We know they are all drug addict criminals just waiting to do something dangerous and illegal like getting high on drugs. We want to throw them in jail too.
But some of them are just here to see their family therapists. They are not even my patients.
DEA is interested in arresting any potential drug addict. Show us your buprenorphine prescribing log.
I uploaded my buprenorphine log to the internet and gave you access to it, Clarice.
DEA doesn't have internet access. DEA is afraid of those nasty computer viruses. Besides, we needed an excuse to have our computer expert here look through your confidential patient files.
He's pretty big for a computer geek, Clarice. Is that a bulletproof vest he's wearing?
Yes, it is a bulletproof vest, Hannibal. I mean Doctor, but he graduated near the top of his Navy SEAL computer gaming and digital combat class.
He looks like he needs some help with the computer. Maybe he's never seen a tablet PC before. Yes, Rambo, that is a computer.
Don't distract Rambo, I mean Agent Jones. He forgot to take his Ritalin today. I need to ask you some irrelevant questions, Doctor, about stuff like your office hours so I can try to catch you lying to me and put you in jail.
I don't have regular office hours. Yes, Rambo, that is a USB port.
Okay. Here's another one, Doctor. Can you refer patients for counseling?
Refer. I can do counseling myself. Shouldn't DEA be investigating doctors who are prescribing OxyContin and dealers selling heroin? Those drugs are killing our friends and relatives.
Are you kidding? Real criminals are too scary for us. We don't want to get hurt. DEA agents are not as afraid of doctors, and if we can make them stop treating addiction, our jobs will be more secure. We like the easy jobs. Hey, wouldn't you like to surrender your license to prescribe buprenorphine to treat addiction now so we can make all this stop?
I can see DEA is putting our tax money to good use.
You should have signed Form 82 like your professional associations told you to. Doctors are not supposed to stand up for their rights. Like, didn't you read the hypocritical oath? You know, the one that says above all do what you were told.
Clarice, I like DEA agents. They taste like chicken.
Watch it, Doc. I have a SWAT team.
Not to mention David Headley. Let's keep DEA agents out of doctors' waiting rooms where they disrupt patient care and compromise patient privacy, discouraging treatment of addiction with buprenorphine. DEA should focus on putting real criminals behind bars. If you are a buprenorphine prescribing physician, don't sign Form 82 unless agents arrive to audit your records at a convenient time for you and your patients. If they try to stay in your office without your permission or warrant, try to get local law enforcement to have them charged with criminal trespass.